Welcome to another episode of Med Madness, your go-to podcast for all things medical. Today we delve into a critical yet often misunderstood aspect of healthcare, hospice care. In this episode, we'll explore what hospice care entails, its key components, and common misconceptions. We'll also share a real-life case study to illustrate its impact. Next, let's discuss an overview of hospice care. Hospice care is a compassionate approach designed to improve the quality of life for patients with a prognosis of 6 months or less. The primary focus is on comfort and dignity rather than curative treatments or life extension. This model of care emphasizes symptom control, psychological support, and holistic well-being. Next, let's discuss the key components of hospice care. Hospice care prioritizes the patient's comfort and overall quality of life. It aims to manage symptoms effectively without the goal of curing the underlying illness or extending life unnecessarily. A significant aspect of hospice care is managing distressing symptoms such as pain, nausea, dyspnea, difficulty breathing, agitation, anxiety, and depression. The goal is to ensure patients are as comfortable as possible during their remaining time. Hospice care involves a diverse team of professionals, including medical doctors, nurses, social workers, spiritual advisors, and bereavement counselors. This team works collaboratively to address the multifaceted needs of the patient and their family. Hospice services can be provided in various settings, including the patient's home, assisted living facilities, nursing homes, and dedicated hospice centres. The flexibility of locations ensures that patients receive care in the environment where they feel most comfortable. Consider the case of Mr. Johnson, a 78-year-old man diagnosed with advanced heart failure. Despite aggressive treatments, his condition continued to deteriorate. His physician recommended hospice care, emphasizing the goal of comfort and quality of life. Mr. Johnson's hospice team managed his symptoms effectively, provided emotional and spiritual support, and offered bereavement counseling to his family after his passing. This approach allowed Mr. Johnson to spend his final days with dignity and comfort, surrounded by his loved ones. Next, let's talk about eligibility and the services provided in hospice care. To be eligible for hospice care, a patient must have a documented prognosis of 6 months or less, indicating an irreversible decline in clinical and functional status. However, there are common misconceptions about hospice eligibility that need to be clarified. Patients do not need to be actively dying. A do not resuscitate DNR order is not required. Functional decline while part of prognosis assessment is not an absolute criterion. Lack of family or caregiver support does not disqualify a patient from hospice care. Hospice services include comprehensive comfort measures, logistical support such as home health care and durable medical equipment, and psychological and spiritual counselling. Bereavement support is also provided to help families cope with the loss of their loved one. In summary, hospice care is a vital, patient-centered approach that emphasizes quality of life, comfort, and dignity for patients with a prognosis of less than 6 months. It involves an interdisciplinary team, flexible service locations, and comprehensive support for both patients and their families. Thank you for listening to this episode of Med Madness. We encourage you to engage with the pre- and post-podcast quizzes and Anki flashcards to reinforce your understanding of hospice care. Your feedback and active participation are crucial for effective learning. Until next time, stay curious and keep learning.